you diagnose the patient with MS today, right? You've diagnosed the patient with MS, you started the patient on treatment, patient went away. Now the patient presents again with symptoms of MS, right? And you're the doctor who's seeing the patient, like, hey, this patient has MS before we diagnosed it already. The patient's here with, some similar deficits as before. But the patient's also got some fever going on. Are you going to diagnose this patient as having a relapse right now? It's called Urthoff phenomenon. Urthoff phenomenon. Or something that's causing their body temperature to go up. It's too hot outside. Or they're exercising and they're getting really hot. Any of those can precipitate MS symptoms, which is known as Urthoff phenomenon, which is a pseudo-relapse but not a true relapse. Typically, your symptoms must last more than 24 hours for actual MS relapse, and you should not have a fever. And you treat that and do not treat them as a relapse. Instead, think of Urthoff phenomenon. Should you tell these patients, because they have to exercise too, right? Are you going to tell these patients don't exercise? Because when you exercise, you're going to get really hot. And if you get really hot, your symptoms are going to come back. You should not. You tell them, be mindful about it, try to cool off, have a fan, but you want those patients to exercise. Because a lot of them think, oh, if I exercise, I'm going to get too hot. If I get too hot, my MS is going to worsen. No, you want them to exercise.